Welcome to the ear. The ear is involved with hearing, yes, but it's also involved with balance and equilibrium. And I'll point out a few things. They don't really get into the equilibrium part at all. They just really focus on the hearing aspect, which, it's not everything that the eye does. Here is the eye in all of its majesticness. We have an external ear, which is everything basically from this membrane all the way out. The external ear's job is to really funnel sound waves towards the middle ear. We have an auricle or pinna. Okay, this is also referred to as pinna. Okay, so for those that know that, you can use that word, okay, if it's there. Auricle is what's in the book, so that's what I'll ask. But it's just this connective tissue here that helps to funnel sound waves towards the external auditory canal. It's outside. Auditory refers to sound, and canal. You can see this sometimes as an external auditory meatus as well. Both of them are used interchangeably. Meatus technically means blinded tube. So sometimes people refer to the opening as the meatus and the canal as the canal. I honestly could care less. We have a connective tissue membrane right here. That's the tympanic membrane. You probably know it better as your eardrum, but tympanic membrane is the fancy pants name. When sound waves hit that, it vibrates, and then it moves bones within the middle ear. The middle ear contains little bones. That's what ossicles mean. Okay? Ossicles are malleus, means mallet, incus, and stapes. Incus is the anvil. Stapes is the stirrups. That's what all of those mean in Latin. When those bones move, that is helping to make these sound waves into mechanical type of energy. And that stapes moves over that oval window, which is right there. That's that foot plate of the stapes is what covers it. And that helps to move fluid within the cochlea here, and then we can interpret sounds. Here in the inner ear, this is where all the magic happens. This is the cochlea. This is involved with sound perception. We have the oval window here, how sound waves ultimately affect the cochlea. Any excess sound exits out the round window. Here is the semicircular canals, and these are the structures involved with balance and equilibrium. Again, breaking the word down into its component parts here. Odo means ear, logist, again, specialist. So this is a specialist that studies the ear. Okay. Otology is just the study of the ear. An ornithologist, otorhinolaryngologist. That's a mouthful. Odo again means ear. Rhino means nose. Laryngo means larynx. And the suffix is a specialist. So we have a specialist for the nose, ear, larynx. Okay. This little spot right here, this thing called the eustachian tube. This allows the equaling of pressure on both sides of this tympanic membrane. Okay, if you've ever popped your eardrum, or if all of a sudden your ear gets stuck, the eardrum gets stuck and your sound is muted. You sit there and you open up your mouth really wide because this is closed off, and that's caused this thing to bulge in a weird way. And when you sit there and you keep opening your mouth over and over and over again, you're trying to open up this. This opens up in the back of the throat. Okay. So anything that's here can drain into the back of the throat and cause some sore throat. Any type of sore throat infection can crawl up this thing and cause a middle ear infection. So fun times. Here's a tasty view of looking at this external auditory meatus and canal. You can see there's some hairs in there, ceruminous glands. That's why it looks all lubricated, producing some earwax. Helps trap foreign particles or whatnot. You're seeing this because of an otoscope. It's just a tool in which to look at the external ear and the eardrum, which you can see back there that it's pointing to back there at the back. Let me help you with this. Okay, that's why oracle and pinna can be used interchangeably. Okay, you may see one question from this slide, you may not. Here's what that tympanic membrane looks up close and personal. It's fantastic because if you do have a great otoscope, again, which is a tool in which you can visualize the ear, here the external ear, the tympanic membrane, you can see the malleus back there. If the person doesn't have a buildup of earwax at all. Okay, it'll have different presentations if you suspect middle ear infection, swimmer's ear, which is swelling on the outside, not in the middle ear itself, middle ear infections, excess fluid buildup in that middle ear, which would cause tubes to be inserted in those ears. All sorts of fun stuff that you can see with an otoscope. Again, these are your tiny little bones, and these help to transmit sound. Okay. Again, when that tympanic membrane moves, that's what causes these tiny little ear bones to move as well. And this is what really helps to amplify sound so you can hear. Again, the anvil, the hammer, the stirrup, and ossicle just means tiny bone. Okay, small bone. Tonsil is tonsil. I don't know why it's in here. Okay, but I described those when I was pointing out everything earlier. Some disorders here, again, knowing what the word means. Okay, knowing what the word means. Media means middle. Media means middle. Oto means ear. Itis, inflammation of, itis. So this is a middle ear infection. It could be acute, it could be chronic. I'm not going to ask you that question. Okay. If it does ask, if when you're dealing with acute otitis media, what is that? What does that mean? Well, it just means a middle ear infection. Okay. If it's chronic, it just means it's going on for a really, really, really long time. Okay? So this is a middle ear infection that happens for a much longer time. I am probably otosclerosis would be fair game. Okay. Otosclerosis would be fair game. That would probably be something that I would ask. Sclerosis, sclerotic, so it's hardening. Oto is bone. So this is a pertaining to a condition associated with the bones. It just makes the bones difficult to move, which you don't amplify sound, so it makes it more difficult to hear. So otosclerosis is something that you see in old age more so than anything. The other one there, cholestoma, is just the buildup of wax within the ear. Okay. Yeah, I probably wouldn't ask it. I don't believe I did. So don't worry about it. It's not a common thing. Most people just say earwax. Oh, we may see some questions here with some abbreviations. URI, upper respiratory tract infection. Again, that can lead to otitis media. We have acute otitis media. We have bilateral otitis media, AOM and BOM respectively. Otitis media. Right. Otitis media, otitis media. A can be acute. B is bilateral. L-A-T-E-R-A-L. Okay, there's otitis media again. E here means effusion. Okay. E means effusion. Just some swelling going on there. some bulging of that eardrum. PE are the pressure equalizing tubes. I don't think I asked it. Most times they're referred to as pharyngeotympanic tubes. These are the tubes that you put in the ear to get the fluid to drain. It's really important because children learn by hearing and copying. So if you can't hear, if the sound is muffled, they don't learn at the right pace, and that could lead to non-development of the brain. Again, URI, upper respiratory infection. So this does a great job of kind of showing you the cochlea as it's kind of like, as they kind of unwind it, it looks like a snail's kind of covering. Here they kind of lengthen it out a little bit to show you that stapes moving back and forth. That's what they're showing you here. This moves, which moves this, and that moves this fluid here. It's moving fluid within the ear. It goes in and hits this area. This is your sensory right here. This is organ of Corti. Kind of hard to really get into a whole hell of a lot here without doing a deep dive into anatomy. And I don't know if I really want to do that to you guys. Okay. But here, this is the cochlea. It has 3 parts. The part that's involved with hearing is the organ of Corti. Sound waves go down there, it hits some receptors. Any excess sound waves dissipate out through the round window. So that's the cochlea. It is a labyrinth because it is a maze of, tubes in this coil format. And when it comes back out, it goes back out. Okay, and there's that middle part. Tube in the middle. Okay, and so you get this kind of setup. Oops, right there. We do have a couple different hearing losses. I may ask this, conductive hearing loss and sensorineural. Sensorineural is easy. This involves in the cochlea, So this is involving C-O-C-H-L-E-A. So this is involving the nerves within the cochlea, or this is involving cranial nerve 8 itself, the vestibulocochlear nerve. So this is a nervous system issue. Okay, this is a nervous system issue. How do I know? Right there, neural, nervous. Conductive deafness is how the sound conducts back towards the cochlea. So this could be earwax. This could be you having something stuck in your ear, swimmer's ear, otosclerosis. Okay, this conductive hearing loss is something that interferes with the conduction of sound waves towards the cochlea. And that's all I'd ask. Okay, that is all I would ask. Again, cochlea is the snail shell. That's what it means. Implant means to plant. Conduction means to lead. When you conduct electricity back towards the brain, it's leading back towards the brain. And vestibule just means interest. Don't worry about that. The vestibule is where the sound waves enter into the cochlea. So that's why they say it, but we really didn't get into it. Again, who's involved with equilibrium and balance? I just want you to know semicircular canals. Okay, semicircular canals. The other word that I would like you to know here is otoliths, and these are just tiny stones. Okay, tiny pebbles. These are really helping you to determine where you're at in space. Okay, are you looking down? Are you looking up? Are you moving left, moving right? Okay, the semicircular canals, the otoliths, those are the structures that are allowing you to figure that out. Okay, I did not ask about the ampulla. I did not ask about the crista ampularis. If you're curious, come to 109 class. We talk about that there. This class, way above and beyond understanding what the heck is happening with these two things. Okay, so I don't want to get into it. And I don't believe I asked any questions about it. Okay, but semicircular canals, balance and equilibrium, otoliths, balance and equilibrium. Those are some of the basic structures that help us to figure out where we're moving and where we're looking to. Vertigo, tinnitus. Tinnitus, again, this is tinnitus. You might think inflammation, okay, because you see IT, but it's ITUS. And tinnitus is just Latin for jingle. This is ringing in the ears, okay? This is ringing in the ears. Ringing in ears. Okay? That's what that is. Vertigo is just Latin for dizziness. Okay, so this is a spinning sensation. Spinning sensation. Benign paroxysmal positional vertigo. This is just intermittent vertigo. Okay, this is intermittent vertigo. Intermittent vertigo. It comes and goes. How does that happen? Those otoliths, they get dislodged and they can float around in the fluid, and that causes all sorts of crazy movements to occur in that crista ampularis. So we really didn't get into it, so I probably didn't ask about that one per se. But vertigo and tinnitus, these I would know. Okay, I would know those two. Last thing here, equilibrium. Librium means balance. Librium, balance. Equal is equal. So we have equal balance in all planes. Again, oto means ear. And paroxysm. Paroxysm, sorry about that. That means irritation. Okay. If I go back, and irritation to the fluid within the eyeball. Within the eyeball, good God almighty. Irritation of fluid within the ear, that's involved with balance and equilibrium. So you're moving this fluid, causes cells to move just because the rocks get dislodged and push the fluid around. And that causes that intermittent vertigo. The last thing, I'll just keep riding here. The last thing we have here is some diagnostic tests. And really the only thing I'm going to really ask is you to know these things. Audiometer, this is an electronic device that generates different frequencies of sound. Very expensive. That allows you to be really specific to test the different parts of the cochlea where different frequencies of sounds are picked up and heard. On a much more basic, low budget type of thing, you can do a whisper test where you just whisper near their ear. Can you hear this? And if they can, fantastic. If they can't, okay, let's do more tests. Then we have Weber-Renée. Okay, and Weber-Renée is just a tuning fork test. This is where we put a tuning fork, we strum it, put it over top of their head, right in the middle of their head, above it. We ask the patient, can they hear it? Yes or no? Okay, they'll say yes. Do you hear it better on one side or another? And then if they do, you go to the side that's all messed up. And then you do Renée's test, you strum it again, put it in front of their ear, and then you put it back and put the base of the tuning fork on their mastoid process. And again, this allows you to kind of see if it's a sensorineural or a conductive deafness issue. That's all I'm going to ask you to do for diagnostic. There's a lot of crazy things here. And you know what? You don't need to worry about it. Okay. Hope you enjoyed it. See you guys next time.